It's an immense pleasure to have you back again for this fourth episode of LabTalk Podcast, which is titled Understanding Analytic Errors in the Laboratory. We're happy to have you again.
Of course, same here.
For our new audience and new listeners, I would like you to just kindly introduce yourself again for those who may not know you yet.
I go by the name Tomnyuy Shaidu Habilu, currently serving as a laboratory quality assurance mentor at Global Health System Solutions and doubles as an ambassador of the African Society for Laboratory Medicine. In the past, my journey started from the Yaoundé Gyneco Obstetric and Pediatric Hospital in Yaoundé right back in 2018. From there, through the Touba District Hospital, the Bamenda Regional Hospital, and I rounded off my journey in the lab at the Quality Healthcare Unit as the head of laboratory unit at the Quality Healthcare Unit Shemka Foundation in Yaoundé. So that is a brief overview of what my journey in the lab looks like.
Wow, thank you very
Thank you.
much for
No,
that. You have a great parcours when it comes to laboratory, and I know that you have a good knowledge on what we are going to discuss about today, even that you have more than 5 years of experience in the laboratory,
of course.
right? So you're in a better position to tell us what analytic errors are all about, how they influence healthcare, the healthcare of a patient, and how to maneuver around those errors. So thank you very much for introducing yourself to our audience. We're happy to have you again. So without which, let's just dive into this session on the topic for today. So Mr. Tomnyuy, would like to know what are analytic errors, what are the common causes in the laboratory?
Okay. So in our previous sessions, we made mention of the fact that when we talk about laboratory analysis, it takes place in several phases. You have phases to be precise. You have the pre-analytical phase, the analytical phase, and the post-analytical phase. Now, when we talk about analytical errors, we mean those errors that occur exclusively within the analytical phase. And it is during this analytical phase where the actual testing of the specimen takes place. Now, when we're talking about analytical errors, we are going to be looking at two types of analytical errors. We have random errors and we have systemic errors. Random errors are those errors that occur or that result from maybe pipetting differences or so those errors that can occur from that can come from a human source. That means at the with when we talk about random errors, it means random errors affect the precision because when we are talking about lab results, we are looking at precision, we are looking at accuracy, we are looking at the timeliness of this result. So random errors affect the precision. That means the reproducibility. That means if one technician runs the analysis and within the analysis there is a random error, the second technician comes and run, there are low chances of repeating that same error. Now, when we talk about systemic errors, these are errors that occur as a result or that occur in a system, just like the word sound. And when we talk about the system, it means these errors are reproducible. It can be as a result of sample expiration. It can be as a result of equipment calibration, that is an uncalibrated equipment. You run everything properly, you are going to get the same result. So with systemic errors, we have the accuracy that is being affected. Generally, when we talk about errors at the analytical phase, those are the type of errors that we are exposed to. Systemic, which affects the accuracy of the test result, and random, which affects the precision of the result. So I think that is a brief overview of what analytical errors are.
Now, when it comes to the causes, what are the causes of these errors in the laboratory? Is it due to poor training, lack of competence of the personnel? What are the causes really?
Okay, yes. Just like if we go back to the errors, like for instance, we talk about random errors coming from or human errors. They you can talk about that's where the issue of poor training can come in. Now, for systemic errors, we could still have aspects like negligence coming in or still poor training coming in if the technician does not know that they have to run equipment maintenance, if they do not know that they have to run quality control before the sample. So we could have these errors. So quality control is actually like a safety net to ensure that the results that we have are accurate and reliable. The quality control helps detect shifts and trends. You start observing a shift and the trend because normally with quality control, when you run the quality control, you document them,
Yeah.
and there is a graph. They call it the
Then graph.
Levigenin's chart. Yes, where you run quality control and then you document them on this chart. When the quality control starts shifting, it starts giving you an idea that here there is a possible systemic error. Here there is a possible random random errors. Or here there is a possible. So it gives you the idea. Then we equally have validating analysis integrity. Here we are going to be running the samples in question alongside quality control samples. It could be pathologic and normal to ensure that they cover the range of possible results that we can have,
Yeah.
and with known results. So the last aspect that quality control help in preventing this error is standardizing performance, and here it ensures that technicians using different machine at different times, using different equipment, produce results that are comparable and reliable. So that is how quality control helps prevent these errors. Thank you.
Oh, thank you once again for those answers. That leads me directly to the next question on quality control. You have mentioned when it comes to quality control, the Levigenis chart, how it detects a shift in the performance of the equipment that you are using, either either being too high, too low, and stuff like that. So when it comes to these quality controls, contribute to the prevention of these errors in the laboratory.
In fact, without quality control, you are working in the dark. Quality control, in fact, quality control tools are the only thing available that we can use to validate our results. And here we are going to be common tools that are mostly used. We have control materials. That means you have samples of known results that you run them in order to verify, in order to cross-check the procedure and the system. Because if you have errors in the procedure or you have errors coming from the equipment, you are not going to have the same result. And those when you don't have the same result, there we talk about a failed quality control. And when there's a failed quality control, it tells you that something is wrong, and you need to do what we call root cause analysis, and not just do a rerun. You try to look what went wrong or what isn't going wrong. Look at both the visible and the invisible aspect that will lead to this. The first thing is quality control materials. The second one is Levigenin's chart, which is equally linked. When we talk about Levigenin's chart, it means you simply run controls, and here we are talking about quantitative controls, because for things like serology, you have controls that are qualitative. They what you need is just a a form with positive and negative colors, where when you run, if it is positive, you say positive; if it is negative, you say negative. So the Levigenis chart is mostly used for quantitative tests, like in biochemistry, for instance. That is where we are going to find a greater use of the Levigenis chart. So you run as much controls as possible and then you plot the chart with the mean of the controls that you have run. Each time you run a quality control, you go and plot the value on that chart. On that chart, you have the mean, you have the standard deviation plus 1, standard deviation plus 2, and the standard deviation plus 3. What you await for in terms of results that are normal is what is within standard deviation plus 1. When it goes to standard deviation plus 2, it start signaling that something might be going wrong, but the result can still be acceptable.
Yeah.
Now, when it goes to standard deviation plus 3, it shows that everything things have gotten
That's
out
the
of hand.
correct zone.
And yes, and depending on how it is moving, it could be on one side of the main, it is suggesting maybe a reagent expiration, or it could be fluctuating from on both sides of the main of this graph.
Mhm.
And so what we have just explained is what they call the Westgate rule. The Westgate rule, that is what is used in order to interpret the Levisianist chart, and then to decide whether or not our QC has passed or has failed. Then
Yeah.
another tool commonly used in quality control is PT panel, or external quality control. Here, samples are sent, because when we're talking about internal quality control, the samples can be generated our from our own lab or from the lab within. That means we take samples, we have tested them previously, we know the results, and then we do a rerun. Now, external quality control is when blind samples come, normally from a laboratory, or from a laboratory that is like a mentor lab to the lab in question, or a reference lab to the lab in question, where it sends sample to labs, and then these samples to the lab are blank samples, but at the level of the reference lab, the results are known. So the lab analyzes and send back the results. If there are issues with the results received from the lab, at the level of the reference lab, they can be able to detect that this is what is going wrong at this particular lab, and it needs to be addressed. So there is a need for corrective action. So those are the various tools that are used in quality control.
You mentioned some tools that a laboratory can use in order to
Yes.
implement the quality control in their facilities. Now, mentioning the external quality assessment, what are some challenges that most laboratory face when it comes to implementing quality controls in their laboratories?
The first challenge, which is the most obvious challenge, is the challenge of supply chain and reagent stability. Because the moment you open a reagent and put on the onboarding shelf, another clock starts ticking, different from the one that is maybe the label that is on the bottle in terms of an expiration date. You take, for instance, if you prepare working solutions for something like creatinine for 14 days, imagine you are using these samples to run quality control. It is not going to, it is not going to, and it is not going to, you are going to have a failed quality control. And if you focus on the expiration date that is on the container, you might be misleading yourself, thinking that nothing has gone wrong. Meanwhile, there's a different biological clock that started ticking from the moment you prepared that reagent, or from the moment that reagent was open. Then another challenge too is with still at the level of the lab, for some serology tests, for instance, most of them are supposed to be stored at 2 to 8 degrees Celsius. And so the normal routine is that in the morning they remove them from the fridge, worked with them during the day, and then in the evening they put them back. What happens sometimes is that these reagents are left on the desk without, yes, and so when they are left on the desk, their storage condition is not respected, and so you might have cases of failed quality control even though the expiration date of the reagent have not yet reached. Like the case we had some few days back with a serology reagent where we had a failed internal quality control, but the reagent was still in date. The second challenge is equipment maintenance, or we can say lack of preventive maintenance. As a laboratory quality assurance mentor, you find it somehow that you have to be the one to move around and you know tell staffs to do equipment maintenance, which is not normal. It is supposed to be part of the routine of the routine activities. And sometimes some of them they don't even know why they are doing. You ask somebody, for instance, you take for instance in the maintenance log of the spectrophotometer, there is a column where you are to check the level of the waste container, and you ask somebody why do you need to check the level of this waste container, and they don't know. They say because it is there. And of course, that is part of preventive maintenance. If that waste gets full and there's backflow into the machine, the equipment can get damaged. It can affect the results that you are going to, because it is the same channel that the sample is going to pass through. That if there is backflow, it is going to go back through that very channel. So lack of preventive maintenance, or just checking the box for the sake of checking, for the sake of checking, or to please whosoever is there. And I remember last week during the World Health Summit in Nairobi, Kenya. I remember very clearly the words of Dr. Mohammed Janabi. That's the director of WHO for
Okay.
African region, who said documents don't save life, action does. And this statement hit me in a different way, because I know in the lab and as a quality assurance mentor, we always lay emphasis on the documentation. But if the documentation is there and there is no action,
Yeah.
no life is
It's
going to
it.
be safe. Of course, if you chart the maintenance log and you do not do the actual equipment maintenance, then you actually did not save any life. Or if the standard operating procedures are there and you don't use them, you decide to do what pleases you, then the documentation, the presence of those documentation didn't save life. So, in as much as in the world of quality assurance, we say not documented, never happened, or was not done, the action too is very important, and there is even more emphasis on the action. The issue of documentation is simply for traceability, to ensure that the action can be traced. But if you document and it is not done, then there is a
Serious
problem.
problem.
Yes. Then another aspect we are going to be looking at is as a challenge is staff competency. Maybe as a result of high turnover, you discover that when we actually do mentorship in several laboratories, you discover that there are some institutions where there is a high turnover of laboratory staffs. So you train this staff today, and then after a few months, the staff has been changed, and then maybe the incoming staff is completely blank as far as quality assurance is concerned, and then you have to go back again and start from the drawing board. Then staff turnover, and then inadequate training. So some staff don't have adequate training. Sometimes we are talking about quality assurance, and then they are getting it for the first time. So all of this, it becomes challenging. We are talking about Levis Jennings chart, Westgate rule. They are getting it for the first time, and so when it's like this, that means they are actually working, but they are unable to detect when things go wrong, or when things are about to go wrong, because, like we said, quality assurance or quality control is our safety net. Then another aspect which affects or challenge to quality assurance is environmental factors, like fluctuation in humidity, dust, temperature. You discover, for instance, with HIV test kit, for instance, They're supposed to be stored below 30 degrees Celsius. And so I think you can testify to this. Sometimes in the lab, you look at the room temperature of the lab, and
It's,
then it's already above 30.
yeah.
Yes, it's already above 30. And so this could influence the quality control if that aspect is not taken through. Because normally when there is a change or when it goes above like that, normally quality or the quality control is supposed to be run on the reagent. So those are some of the challenges that we face in our labs.
You mentioned it right, especially when it comes to environmental challenges, that's fluctuation in temperature, as you mentioned, because it doesn't only influences the quality control, but even the test itself, because you can get to a point where you run some analysis and you get invalids several times. You run the first time invalid, the next time invalid, and you start wondering what's the problem. Then when you get to do some root cause analysis, you discover that the storage condition was not respected. But like you mentioned, documents don't save lives. Action
Yes.
does, right? But when you maybe run the root cause analysis, you see that they have documented the temperature chart appropriately, but you wonder why this test kit has said giving invalid results. That still points out to the fact that you can still document, but what you are documenting does not reflect what you are doing actually in the laboratory. That was a very important point that you mentioned. Thank you very much to that. And I want to ask another question, right? You mentioned a point on competency of staff. That's a frequent rotation of personnel in the laboratory. I think that we cannot avoid that. At some point, we cannot
Yes.
avoid that because some people may move due to family reasons, maybe they are sick, as many other reasons. Now, when it
Of
comes to
course.
because this personnel really should have some precepts and some knowledge when they leave school already. Now, what's the responsibility of the training schools in ensuring that laboratory perform adequately when it comes to giving out quality results?
Okay, yes, I think it's very important for this training school to introduce a course specifically on quality assurance.
Yeah.
Yeah, that is what if I am to give as a recommendation, because you find students coming or leaving school and then they are completely blank about quality assurance, which already tells us the type of results that we could be expecting. Because
Mhm.
if you don't know when things go wrong, it is going to be difficult to identify that actually something went wrong here. And I'm going to if an incident that happened some few days back while I was working at the lab. There is one of my labs. They recently acquired the spectrophotometer, and so the technician that was there was not versed with biochemistry. So she went for training and was trained. So when she came back, she was running some tests. We are working together, doing the calibration and all the like. So there were some samples that we had to run together. But as you know, blackout didn't permit electricity. I went back and then she stayed back and did the analysis by herself. So when I came back the next day, she she told me that she had run the analysis and these are the results, and that the results are normal. So she was asking me if it is normal that the results are normal, because she was expecting maybe a pathologic result. And I asked her, "Did you run the quality control samples? What did it give? What did it give you? It is not. It is not based on what you are expecting, or maybe that because you are expecting pathologic results. That if you have normal results, then that one becomes
The false
a
results.
reason for you to rerun.
Mhm.
Yes, the validation is based on your quality results.
Yeah.
If your quality control results were okay, then on that basis, you can validate whatever you have, whether it is normal or it is pathologic. So I think the schools that are training laboratory technicians should try and integrate this in part or integrate quality assurance into their syllabus. It is going to go a long way to attain the objective of the training that they have, because you cannot talk about a laboratory without talking about quality assurance. The two move hand in glue. Thank you.
Yeah. Exactly. Thank you very much for that intervention. But the last question I will ask will be the strategies on how that a laboratory can adopt to mitigate this analytic error.
Okay, we have already seen the challenges, and if I can take you back to where we started from, we talked about random errors and systemic errors.
Yeah.
Now, to address random errors, the lab can put in place an automated system, because random errors occur. That they may be errors from human source, maybe pipetting procedures and respect of the procedure. So, putting in place an automated system helps curb down these errors. Now, for systemic errors, for labs to improve, they must implement what we call root cause analysis every time there is a failed quality control, and not just rerun, because maybe they want to rush home, is almost break. When the quality control fails, they simply just rerun or swap. It
Yeah.
is very important for us to know there was why it failed,
Yeah.
so that we can take precautions to avoid further to avoid future cases. And
Mhm.
then another aspect is regular training of staffs on ISO 15189. I think is also going to go a long way to improve the accuracy and the reliability of results of being produced by this lab. And then another aspect is internal audit. Should be able to auto-evaluate itself before an external auditor ever comes for evaluation. This permits it to identify areas where things might be going wrong, or maybe to, you see, you find maybe like internal quality control logs, for instance, being chatted, but the lab heads never reviews them. That means even if the person at the bench, if they miss something out, it gets missed out completely because there was no revision. And it is during internal audits that the lab head or the quality assurance officer can be able to pick out these shifts that were unable to be detected by the technician on the bench. And then what labs can also do is to do a pay comparison. If you are in the same city, there are several labs. You collaborate with those labs. You run samples at your own lab with your own machines, and then you send the same samples to your neighboring labs. They run the same samples, and you compare instruments performance, and then see if you can have results that are, because results should not, or difference in instrument should not be the reason why you will say we had a completely different result. There's a difference between, you can have a different result and the different result is the same result. That means you have a different result because you have the result is a different value, but the difference is simply a slight difference with precision. Or you can have a result that is statistically different. That means a result that is completely different. So the value can be different, but you have a statistic, but it's statistically the same. So when you do an interlab comparison, you can be able to pick out this aspect to see if your equipments are actually working very well. So those are some of the things that labs can do to mitigate these challenges, or to improve on the reliability and the accuracy of their results.
Exactly. Thank you very much for those recommendations. It's always our tradition to share a keynote message at the end for each specific topics. You know, it's very important to really put an emphasis on some point. I would like you to
Yeah.
give one key message that you want our audience to really take home, right? Like a take home message on this particular topic on analytic errors. What will you tell them?
The first thing to bear in mind is that errors are possible.
Yeah.
Now, errors are possible, and they could be from two sources. It's either they are coming from you as a technician, or they are coming from the system.
Mhm.
Now, you as a technician, what you should do is ensure that you are versed with the process and that you take necessary precautions to avoid random errors.
Mhm.
And then the second key message, take home message, is to be keen and know how to identify when things go wrong so as not to send out results that are not reliable. So that is the take home message that I have for our televiewers, and equally to keep in mind that documents don't save life, action does.
Exactly.
Thank you.
Thank you very much. Thank you very much for that emphasis. It's very important that we are really keen in the laboratories because if not, a lot of things are going to go wrong, especially the aspect of being keen because an error can be taking place and you are just running your tests and going without even notice at the end of the day, you discover that the samples that you ran from maybe 12 p.m., all of those results were out of range. So
Of
it creates a really big gap when it comes to analysis because if you give out wrong results to the patient, you are not actually helping the patient. You are actually putting the patient through more stress. So it's very important that a laboratory professional should be very keen to his work. Thank you very much
course.
for that keynote. And thank you very much again for coming a second time. And I believe that there will be a
Of
next
course, of
time
course.